Hello everybody, I am Dr. Moinuddin Mohammed, Consultant ENT Surgeon from Care Hospital, Nampally, Hyderabad. After all these hard days we have been fighting with COVID-19, now we have another threat to our society, to all of our lives, that is black fungus. Black fungus is nothing but a kind of infection to our sinuses, primarily caused by funguses. There are different types of funguses which can cause infection to your sinuses. Now, these sinusitis again is divided into two types. One is invasive fungal sinusitis, another is non-invasive. The non-invasive type of sinusitis doesn't cause much threat to your life, whereas this invasive fungal sinusitis causes much threat to your life, which includes the black fungus, what we are seeing nowadays. Now, how do you find this difference between the sinusitis and the mucormycosis, which is also called as black fungus? Bacterial sinusitis is very slow and it progresses very slow, and the symptoms are not as typical and as painful as you get during invasive fungal sinusitis. In mucormycosis, you get sudden symptoms of, the day before yesterday were all right, maybe, in a day or two you get symptoms like, the facial pain or pain in your head, throbbing headache and decreased in vision. Sometimes you get blurred vision, double vision, and, facial swelling and some swelling across around the ear, around the eye. So these are the slightest of symptoms which you can observe and consult a ENT surgeon. After you consult a ENT surgeon, probably we would be able to examine you, send a nasal swab for microbiology and histopathology, and if it is fungal sinusitis, then we see like whether what kind of fungus it is. If it is mucormycosis, then we have to be serious and act upon that immediately. Now, treatment for fungal sinusitis is of two types. One is medical management, another is surgical management. For fungal sinusitis, which is caused by this mucormycosis, you have to undergo examination as soon as possible, and if necessary you have to undergo surgery which contains of removal of all the debris which is found in the nasal cavity and in your sinuses. So we call it a radical dissection of all involved sinuses, and we remove all those involved parts, failing which there are chances that people may lose their eye if it is spreading to your eye. And in some cases we have also seen that it has gone to the brain, where the mortality is more. And in different cases we have already seen that these fungal sinusitis from nose to eye to brain, and it has gone to the lungs also, where the chances of survival are minimal. So what we advise is, whenever you are having some kind of problems like diabetes, or you have some lesser immunity because of medical problems you have due to your liver problems or due to any kidney or liver or lung transplant, or anybody who is having current COVID infection or who already had COVID infection and were subjected to steroids, have to be very careful. When you have uncontrolled diabetes or when you have used steroids, you have to be very careful, because this gives a chance for this fungus to grow upon those sinuses. This mucormycosis is pretty dangerous because its spreading pattern is different. It spreads into the lining, mucous lining of your nose, then it gets into your surrounding bones, and it also crosses the barrier and gets into your brain as well as eye. Some of our patients who could not report to us immediately had to lose their eyesight, and some of them had to get rid of their eyeballs, and some were unable to get out of ICU because of their immune system. So here what we advise is, anybody who has these symptoms of sinusitis should not take things easily, should immediately report to a ENT surgeon and get them examined. It's pretty easy. Like we brush our teeth every day, we don't clean our nasal cavity, so which is ignored many a times. So it would be better like if you just come to a ENT specialist who can just have a look at your nasal cavity and examine your sinuses. And if there is any problem, probably you can avail the best of the treatment. So meanwhile, what we can advise you is to stay away from over-the-counter medications like antibiotics, steroids, and anti-diabetic medications. Just don't use upon yourself. Don't use all kinds of experiments on yourself. If there is any problem, you can avail expert opinion from any of your ENT specialists who are around you and get it right treatment which can save not only yourself and but your loved ones. Thank you.